Improving Lives, the Work, Health and Disability Green Paper. Ministerial Foreword. This government wants a country that works for everyone. Wherever you come from, or whatever your situation, you should be able to get the right health support and reach your full potential. A person's talents, their determination, and their hopes to succeed. This is what should count. A disability or health condition shouldn't block the path a person can take in life or in the workplace. But our current health and welfare systems don't always help people to go as far as their talents will take them. Too many people fall out of work when faced with ill health or a condition that's getting worse. Too many then struggle to get back into work. When out of work, their well-being and health can get worse. Employers miss out. They lose valuable skills. Health services face more costs. This has to change. We know the right type of work is good for our physical and mental health, and that good health and the right support help us in the workplace. Our systems need to recognise this and offer the opportunity to work for all those who can, help for those who could, and care for those who can't. The UK has a strong record on disability rights, and the NHS gives unparalleled support to people with poor health. Yet millions are still denied the chance to fulfil their potential. It's time to go further. We want to halve the disability employment gap, and know many others share this goal. Our ambition is bold. Change requires real, innovative action. We must highlight and challenge the minds, prejudices and misunderstandings that are still in many employers' policies and attitudes within the welfare state, across the health service and in wider society. This Green Paper launches this action and a national debate. What will it take to transform the employment prospects of disabled people and people with long-term health conditions? This government is committed to act, but we can't do it alone. Please get involved. Let's all help us make the best use of our talents for a healthier, working nation. 1. Tackling a significant inequality. The pressing case for action. As we have said, we are a government that wants to help everyone, whoever they are, enjoy the independence, security and good health that being in work can bring. Many disabled people and people with long-term health conditions already work, and many more want to. We want to understand how to improve the system to make this possible. We also want people to get financial help in a way that is simple and straightforward. This consultation discusses improving how we decide what financial support people need, but is not seeking to reduce the amount of money people receive further than already passed into law. Closing the disability employment gap to tackle injustice and build our economy. The UK employment rate is at its highest since records began. But while 8 in 10 non-disabled people are in employment, it's fewer than 5 in 10 for disabled people. This gap has been like this for many years. It is unfair that 3.8 million disabled people are out of work, despite a record-breaking labour market. That's why we want to halve this disability employment gap. As well as being unfair, this is a waste of talent and potential which our country can't afford. The cost of ill health among working-age people is around £100 billion a year. The cost to government relating to people who aren't in employment or looking to enter employment is around £50 billion a year. On top of this, the NHS pays £7 billion for treating people with conditions that keep them out of work. The cost of sickness absence to employers is estimated at around £9 billion a year. We need to understand why disabled people might be unable to get a job or keep one, and to recognise the wide range of conditions and circumstances they face. Where people live can have a big impact on both their state of health and employment. Negative attitudes can also be harmful. There may also be physical barriers to employment for some people, such as difficulties with transport and buildings. People with particular health conditions can also be disadvantaged. For example, only 35% of people with mental health conditions are in employment. Of course, many health conditions get better or worse over time. But once someone is out of work because of a health condition and claims the benefit employment and support allowance, their chance of finding work is low. Some people won't be able to work and therefore need financial support. However, for many people, the longer they are out of work, the more their health condition worsens. This is a complex picture, and there is no simple, one-size-fits-all answer. We need a system that puts each person at the centre and gives everyone the chance to do well. Tackling system issues. This green paper looks at how employers, the welfare system and health services can work together to keep people healthy and in work where we can. It also takes into account the important roles to be played by disabled people and people with long-term health conditions themselves, and others such as carers, the voluntary and community sectors, devolved administrations, and local authorities. Achieving lasting change. Investing in innovation. Such big change will take time, and we want to work with others to see where we should focus our efforts. But in the areas that we already know are important, we want to take early action to gather good evidence. We are spending £115 million of innovation funding to develop new, better models of support for individuals with work and health needs. We will also work with Public Health England to develop a set of work and health indicators and identify how we can best bring together and share existing evidence for use at a local level. Questions. What innovative and evidence-based support are you already giving to help the health and employment of people in your community? Could these ideas be done on a wider scale? What evidence did you use when deciding to invest in the support? What evidence gaps do you have in your local area in relation to supporting disabled people and people with long-term health conditions? How should we develop and share the evidence base to influence decisions on what services are designed and put in place? Achieving our shared vision. This green paper discusses a number of areas where we want to see change to make systems work for people. This means supporting more people into work, assessments for benefits for people with health conditions, supporting employers to recruit with confidence and have a healthy working culture in the workplace, supporting employment through health and high-quality care for all. At the end of the green paper, we talk about the role we all can play in making this happen and explain how you can respond to this consultation.